Hello, my name is Michele LaBotz. I'm a sports medicine physician up in Maine and a TrueSport expert, and today we're going to answer some questions that have come in from some families of young athletes. Let's start. So question number one here. When should I require my high school athlete to skip a practice or a game because they aren't feeling well? You know, when you consider whether or not an athlete who's not feeling well should participate, it's important to keep in mind two different things. First of all, what's safest for the athlete? And also, how do you minimize risk for those who are participating around the athlete? And when we talk about the ill athlete, we invoke something that we kind of loosely call the neck rule. So if there's mild symptoms above the neck, a runny nose, earache, sore throat, and the athlete feels up to participation, it is generally safe to allow them to do so, as long as they're not getting worse over time. However, if there are symptoms below the neck, or symptoms that really are kind of full body, so fevers, body aches, diarrhea, big coughs, that type of thing, those are athletes who really should refrain from participation until they've fully recovered. And you should not use fever reducers or over-the-counter medications to allow them to participate. For athletes who are participating in close proximity to others, you really want to kind of take care and make sure that you don't spread infections throughout the team. Every year, young athletes and their teams are taken out of competition because of infections that kind of run through the team. And you don't want your athlete to contribute to that. If you're suspecting a more severe illness like COVID or influenza, just be mindful that any participation in close proximity to other athletes does have the potential to spread. So you want to make sure that you're taking care to avoid infection, good hand washing, good infection control when you're working closely with other athletes.